Chances are we've all popped or picked a pimple on our face, but what if picking became a true obsession that controlled your life? This is Angela's story.
I have a condition that causes me to pick at my skin, and it's called dermatillomania. I pick at my face, I pick at my upper chest, and I pick at my legs. I've had it since I was a child, and it was diagnosed as acne, but it got worse throughout the years. I do it without knowing when I'm doing something like watching TV or on the computer. When I go to the bathroom, and I even do it in my sleep. I was so ridden with the shame and guilt. I hated myself, I hated my appearance. I went years without dating anybody or getting close to anyone. I have gotten infections from picking. I had one on my chin. The doctor refused to treat me. He said because I did it to myself. It was a really humiliating experience. I've been in therapy before, but it was very unsuccessful. I had a mental health nurse tell me that all I had to do was grow up. If my husband tries to stop me from picking, I immediately feel like this panic, given that I now have this long 18-year history of picking, and it's changed me as a person from who I could have been.
Clearly Angela's problem, it's more than skin deep, so we sent her to one of the country's top specialists in this disorder.
Angela? Hi, I'm Karen. Hi. Nice to meet you. Why don't you come on back? You mentioned that you feel powerless over the skin picking. Can you tell me a little bit more about that and how it feels?
When I say I'm powerless to the behavior, that I can't actually stop it. I do know some tips and tricks that can help, but it's like I'm still left with just the urge that's so strong. I've even had like physical withdrawal symptoms from fighting through the urge where I couldn't even function.
Can you imagine a life without skin picking?
It's like I'm a completely different person if I don't pick my skin, but it feels like that this is what I have to do. I'm at a point where I need to learn to recover, and I want to say I've made it through and I've actually been able to manage these urges. That would mean so much to me.
Angela joins us, and we thank you so much for sharing your story with us.
Yeah.
And also, we're joined by licensed psychotherapist Karen Pickett. What's interesting about compulsive behavior in general is it's really close to normal behavior. I think part of the shock of the audience, quite frankly, is empathy, because we've all picked, and we all have empathy because there's a small part of us that looks at areas in our body where we've picked so much that we've gotten scars. So when you evaluated, in this case, which clearly is a compulsive behavior, you know, what did you find during that evaluation, and what do you think can be done to alleviate this?
Well, you know, Angela has suffered with severe skin picking for a long time, and I think that on some level that she's given up hope, that there isn't something else that she can do, and yet she maintains a positive attitude and acceptance anyway and goes about her life. But I don't think she's exhausted all of the resources that are available that may not be available in her area.
Mm-hmm. And so you think that with some therapy and more time, why is this happening, working towards therapy, you think that she can truly overcome this?
I do believe that Angela can get significantly better, and that while she's been to many doctors and therapists, you know, what happens is when you're not able to find somebody who knows how to deal with skin picking, and it is a disorder that many people don't know about, and a doctor says, well, you know, just stop doing that, or whatever it is, that's not helpful. And it makes the person feel more and more hopeless.
Asking both of you this, so is there a, you know, I know with trichotillomania, there's kind of a euphoric feeling every time you pull. Is there kind of a euphoric feeling when you're picking?
Yeah, like it's almost like, you know, I'm trying to get this feeling of accomplishment. Like I like to say a sigh of relief. And it's kind of because these behaviors fall under an umbrella term, the body focus repetitive behaviors. So I was diagnosed with trichotillomania and OCD, a combination, But in fact, I do have a bit.
Trichotillomania, meaning that you were pulling the hair out of the follicles each time you...
Pulling the hair out of my legs, for example, and that's part of my skin picking too. And then, like, you know, I will dig deeper to try to get like a root out or something that I don't think should be there. So they do a lot of times overlap because they're so close together.
So it's kind of a calming feeling for you.
And that's what those marks are. She said her diagnosis is excoriation disease. All of these marks are what we call an excoriation. And you know that you really are putting yourself at risk, your health, with this continual picking. You said you've already seen a doctor because you had an infection, and you know that a small infection can turn into a big infection, can spread throughout your body, for example. And you know, I have to tell you, and I'm seeing it on your face, as a result of all of this picking, that you have left scars on your face, and you have to come to grips with that, you're making it worse.
I believe that I already have come to grips with it. I just don't know how to stop.
Well, you are really brave to share this with us, because I think this is something not a lot of people know about, and plenty of us deal with it, whether it's to the extreme that you're doing it or just to a certain extent. So I really appreciate you coming on and sharing this with us and kind of opening your life up.
Karen met with you that one time, but Karen has also graciously agreed to offer you a session or a course of 12 treatments to try to work with you on a consistent basis to help you get through this, if you would be willing to work with her. And we just hope that you can find the answers you're looking for. And there are people here watching right now. We'll have resources on our website, thedoctorstv.com. Thank you.
Yeah, thank you.
Karen, thank you. We'll be right back.